Today we're going to show you how to insert a Foley under sterile technique.
The first step is hand hygiene.
The next step is to gather necessary supplies and set up your sterile field.
I'm going to start by putting my lube into the sterile container, and then I'm going to move the tray over so that I can take the Foley out of the sleeve and put it into the lube without touching anything else. I'm also going to attach my water syringe to the port so that it's ready for when I'm ready to inject. Next, I'm going to open the swab sticks and lay them out in my tray. Then, my left hand is going to now be dirty, and I'm going to clean with my right sterile hand. I'm going to start in the middle, right over the urethra, and go down, and get rid of that one. Then my second one, I'm going to go on the right side, and the other one on the left side. Next, I'm going to grab the catheter and bring it over. And I'm going to insert it right into the urethra. I'm going to keep inserting until I get urine return. And then I'm going to blow up my balloon. A few important things to remember is to keep your bag below bladder level, make sure that the tubing is not pulling on your patient and that it's properly secured on their leg, and that you're dating and timing when you put the Foley in and who did it.
Now I'm going to show you how to do Foley care. Alright, first and foremost, you want to put hand sanitizer on, do some good hand hygiene, and then get some gloves on. If you were already wearing gloves doing other stuff in the room, you want to change your gloves. So this is the 5 and dry method. So we're going to have 5 washcloths to wash with and then 1 to dry with. First, get your cleaning washcloths wet. Then put some soap on there. Okay, so for the 5 washcloths, you're going to have your first 2 be kind of the outer leg area. So just 1 clean swipe like that. Just throw it away. So second one, clean swipe on the other side of the leg. Throw it. Third swipe, you're going to kind of go inner labia on one side. Just 1 swipe. Don't scrub it. And then the other labia. And then last but not least, you're going to go down the actual catheter itself. Just get anything that might be sitting on there. And then, for your dry one, you're just going to pat everything nice and dry. And then boom, Foley care.
Things to always remember when taking care of a patient with a Foley is to make sure that the urine in the bag isn't cloudy, and make sure that the urine doesn't have any kind of odor, and also make sure that your tubing isn't kinked and that your urine's flowing properly, and also just make sure that you're emptying your bag regularly and not letting it become too full. And also just make sure you're doing Foley care once a shift, along with doing it if they have a bowel movement.
Use your critical thinking. Ask yourself, do you need this Foley? How long has it been in? Talk to the doctor and get that Foley out so they don't get a UTI.